Welcome back, class. Today we're diving into week 3, covering chapter 9, the digestive system. This is one of the longer chapters and therefore PowerPoints. So take your time, go through it carefully. So, first, we'll establish the physiological functions in the system. Second, we'll identify structural terms. And finally, we'll learn how to dissect terminology related to GI disorders, diagnostic testing, and surgical interventions. Let's first look in the anatomy and function. Let's review the basic anatomy to ground our vocabulary. The tract is divided into the alimentary canal, which is the actual tube that food travels through, and accessory organs, which assist in digestion but don't hold food. So if you note, the path includes the mouth, esophagus, stomach, small intestine, large intestine, rectum, and anus. The accessory organs include the salivary glands, liver, gallbladder, and pancreas. So keep this sequence in mind, as surgical terms often combine two of these organs to describe a reconnection pathway. So note the suffix ation, which means action or process. Alimentation is derived from alimentum, which is nourishment, the overall process of providing nutrition. Ingestion includes in, which means into, and GERERE, which means to carry, literally carrying food into the mouth. Digestion includes di or dis, meaning apart, and gerere, which means to carry, carrying or breaking food apart. Remember the difference between mechanical, which is the physical chewing and churning of food, and chemical, using enzymes and acids to break apart food. Absorption is the process of sucking up or drawing in microscopic nutrients into the bloodstream. And finally, elimination versus defecation. Elimination is the broad systemic process of managing and moving waste out, and defecation is the specific final voluntary act of expelling feces from the rectum. When charting or reading clinical notes, you'll see a clear distinction between the alimentary tract and accessory organs. The key word root to notice here is gastrointestinal. If we break it down, it's gastro, stomach, intestine, intestino, which means intestines, and al, which means pertaining to. Overall, this means pertaining to the stomach and intestines. Let's also make sure we distinguish between the pharynx, which is the throat, and the esophagus, the food tube leading to the stomach. So the large intestine is a prime target for medical coding and terminology. The combining form for the colon is colo. We specify sections structurally: ascending, transverse, descending, and sigmoid. Look closely at the sigmoid colon. The prefix sigmo refers to the Greek letter sigma, which is S-shaped. The veriform appendix hangs off of the cecum, and vermi means worm-like, and form means shape. So when we focus on the mouth, the salivary glands include the parotid, which breaks down to par, meaning near, and atid, meaning ear. The submandibular, which is sub, meaning under, mandibulo, meaning mandible or jawbone, and sublingual, meaning sub under, and linguo, meaning tongue. In the right image, notice how the common bile duct connects the liver and the gallbladder down into the duodenum, which is the first section of the small intestine. We'll talk more about that in the combining forms. So the small intestine has 3 distinct sections, and they are represented in these combining forms. The duodenum is the combining form duodeno. Jejunum is the combining form jejuno, and ileum is the combining form of ileo. So, spelling tip, we discussed this earlier. Be careful not to confuse the ileum with the E, which means small intestine, with the ileum with an I, which is the pelvic bone. Here's just the molars, bicuspids, cuspid or canines, and incisors in the mouth. And then we have terms for gingiva is the noun for gums. Gingival uses the suffix al to make it an adjective. Now let's contrast sublingual versus hypoglossal. Both translate literally to under the tongue because linguo, Latin, and glosso, Greek, both mean tongue. However, sublingual is the structural delivery term, like sublingual nitroglycerin tablets, whereas hypoglossal is the neurological and anatomical term, specifically referring to the 12th cranial nerve controlling tongue movement. So if you look at the prefix peri, which means around or surrounding, we'll add that to our terms. Periodontium is peri, around, plus odonto, tooth, plus eum, tissues and structures. So the structures anchoring the teeth. Pedodontics is pedo, meaning child, plus odontics, odonto, and ix, specialty. Pediatric dentistry, and finally orthodontics, ortho, meaning straight or correct, plus odont, tooth, ix, literally the specialty of straightening teeth. So let's move on to digestive proteins. There's a major rule for medical terminology in biochemistry. The suffix ase always denotes an enzyme. To find out what enzyme, you just look at the root word. So amylase combines amylo, meaning a starch, to ase, which means to break down starches. Protease is proteo, meaning protein, plus ase, which means it breaks down proteins. If we continue this theme, we have lipase, lipo, meaning fat, or lipid with ase, which means to break down dietary fats. Lactase breaks down lactose, milk sugars. And notice how chemical sugars end in OSE. We'll discuss that in the next slide, while the enzymes that break them down end in ASE. So here are our digestive sugars. The first one is lactose, so OSE, meaning sugar. So you have which stands for 2 saccharized sugars. When lactase, the enzyme, breaks it down, it splits into 2 monosaccharides, mono meaning 1. Galactulose and glucose. Glucose is the simplest form of sugar, immediately ready for cellular absorption. So I'm not going to go through each and every one of these word parts, but these will be specifically important for you to memorize and continue using. So here is all of them for you to review and get locked into your memory. Here's a knowledge check, and then we have a brain break. We're going to go on to diseases and disorders. So emesis means vomiting. When we add that to hyper, which means excessive, we have excessive vomiting. Diarrhea, dia means through, and rhea means flow or discharge, literally meaning flowing of the feces, right? So anorexia versus anorexia nervosa. An means without, plus orexia, which means appetite. Anorexia is simply a symptom meaning loss of appetite. However, when you have anorexia nervosa, it It is a psychological eating disorder characterized by purposeful extreme food restriction. Cirrhosis is named for the orange yellow color that often relates to the fact that there's a problem with, you'll see yellowing skin. So, cirrho actually means that orange yellow color, and that denotes a chronic liver scarring. Hep, hepatotoxic combines hepato, which is liver, with toxic, which means poisonous and damaging. So this literally means damaging to the liver. And hepatomegaly is hepato, liver, plus megaly, which means enlargement, an enlarged liver. So let's look now at our bile, some of our bile terminology. Um, Cholelithiasis is chole, which is bile, plus litho, which is stone, plus iasis, which is abnormal condition, gallstones in the gallbladder. So when we have the cholecystitis, that means a cholecyst, which means gallbladder, and itis, which is inflammation. And cholestasis is chole, which is bile, plus stasis, meaning stopping or standing still. And that's the stoppage of bile flow. So, diabetes mellitus involves altered insulin pathways. Looking at hyperlipidemia or you have the hyper excessive plus lipid fats, and anemia, which is a blood condition, high fats in the liver. Dysphagia um, involves dys, which is difficult or painful or bad, plus phagia, swallowing or eating. Spelling tip here, we don't want to confuse this with dysphagia with an S, which means difficulty speaking. We look at gastroesophageal reflux disease, the abbreviation GERD. That is gastrostomach plus esophago, which means esophagus, plus EAL, which is pertaining to essentially a chronic acid reflux where stomach acid flows back into the esophagus. So these are just some more terms. You can see how they're broken down. Practice them, practice with breaking them down, and then look at the term and try to go backwards. So enteritis is entero, which is small intestine, plus stasis, stoppage, slowing. Diverticulitis is an inflammation of the small pouches, the diverticula in the bowel wall, and peritonitis breaks down as peritoneo, which is referring to the peritoneum, the main lining in the abdominal cavity, plus itis, which is inflammation. And this is considered a life-threatening medical emergency. Hyperglycemia is hyper, high, plus glyco, sugar, plus emia, blood condition. Polyphagia, polyuria, polydipsia all use the prefix poly, which means many or excessive. Therefore, you can see that there could be excessive in all of these: excessive urine, excessive eating, excessive hunger. Glycosuria includes glyco, sugar, plus uria, urine condition, and that means sugar in the urine. When we look at these conditions, we see they all end in itis, which means inflammation. And you can see there's inflammation of the lips, inflammation of the gums, inflammation of the tongue, inflammation of the mouth, mucous membranes, and it all is dictated by that root word. Here's a knowledge check. And now we're going to go into diagnostics and interventions. So let's distinguish the suffix logy, study of, with logist, one who studies or specializes. A gastroenterologist diagnoses and treats GI tract conditions. If surgical interventions is needed for the rectum anus portion, they often see a proctologist, procto meaning anus or rectum. Radiology uses contrast dye to map the tract. A barium swallow maps the upper tube esophagus. A barium meal evaluates an upper GI series, stomach, or duodenum. A barium enema maps the lower GI series, colon, and rectum. The suffix scopy means visual examination with an instrument. The word root tells you exactly how far down the camera is traveling. So, endoscopy is the general term for using a flexible tube with a camera, an endoscope, to visually inspect the inside of any organ or cavity. So you see this scope can be used to study the esophagus, stomach, colon, and also the rectum area. So these are just some more studies. This list also includes the liver biopsy, and often that includes a small needle penetrating. So the biggest concern for this is that this patient would still be at a risk for a hemorrhage or infection. So the cholecystectomy is the cholecyst, which is gallbladder, plus ectomy, which is surgical removal of the gallbladder. And this is often done via laparoscopy, and that makes it a minimally invasive procedure. So you'll hear in the hospital that this is called a lap chole. Vagotomy, it includes the vago, which is the vagus nerve, plus tomy, which is an incision. So it's a surgical cutting of branches of the vagus nerve. And this is typically performed to reduce stomach and secretions and treat ulcers. So if we dissect the term lithotripsy, you have litho, which means stone, and tripsy, which means crushing or crushing surgical procedure, literally stone crushing. Laser lithotripsy crushes stones from the inside out using an endoscope, while shock wave lithotripsy crushes them from outside the body using acoustic waves. So an appendectomy is the removal of the appendix. The pancreatolithenectomy combines pancreas plus litho, stone, and ectomy, which is removal. It's the surgical removal of a stone from the pancreas. And a gastrectomy is the surgical removal of all parts of the stomach. A colostomy is an opening created in the colon or the large intestine. The ileostomy is an opening created in the ileum of the small intestine. And the gastroduodenostomy is gastro, stomach, plus duodeno, that's the duodenum, plus stomy, which is a new opening and connection. And this is a surgical reconnection of the stomach straight to the duodenum. So here are some weight loss surgeries using the root word of gastro. Gastroplasty is gastro plus plasty, which is a surgical repair or reshaping. Gastric bypass, one of the most common, being Roux-en-Y, creates a tiny pouch that connects directly to the jejunum, completely bypassing the duodenum to limit calorie absorption. For feeding tube, we look at the path prefixes. Naso meaning nose. A nasoduodenal tube travels from the nose to the duodenum Tubes surgically placed directly into organs utilize the same stomy suffix. Gastromy, gastro, which is a G tube, is an opening exactly into the stomach, and jejustomy is a J tube, and it is an opening directly into the jejunum. So some pharmacological suffixes and prefixes modify basic functions. Anti meaning against. So an antiemetic works against emesis, it stops vomiting. An antidiarrheal works against diarrhea. An emetic induces vomiting, used in certain poisoning emergency cases. And an anorexiant suppresses appetite. So here's a knowledge check for you. And so I just want to end with covering some resources to learn and retain as we are building our database and our toolkit full of terms. You want to practice some different ways to retain and learn these terms. So apply your course content to your actual working profession. So if you're in the hospital, try to do that. Also, there are some strategies in the learning science strategies folder, and that can be found in the course resource module on Brightspace. And finally, a strategy for the week is you could write down a simple stable root or suffix, say nia for breathing, and then add as many words, whether those be suffixes or prefixes, or change to change the definition and meaning of the word. And so that's it. This was a much longer chapter with more content and concepts. So definitely take your time in reviewing and reinforcing your learning. Thank you.